Now, Mel, I've actually hurt my stomach. I think I've got too many abs. Is that possible?
I think you do have too many abs, Shane, absolutely. You might need to cut a couple of those out.
I've been working out and working out hard. I'm here because I want to know, what is a physio?
Okay.
When people go, what is a physio? I go, oh, they fix you.
Okay.
So what is a physio?
I guess if you look at the way we are trained, we've got a science degree, and our science degree allows us to do a whole host of things. Public perception is such that we would look at perhaps sports injuries, hamstring tears, ankle sprains, sore neck, sore back and so forth, but we actually have a much wider scope than that. And I guess if you look at it simply from a sporting point of view, what we're addressing is either one of two things: either normal tissue which is placed under an abnormal load, so for example a hamstring tear or an ankle sprain, or normal tissue, sorry, beg your pardon, or abnormal tissue placed under normal load. So if, for example, you've got degenerative disease, arthritis in the knee, or you are ageing, then you consider that abnormal tissue and it's actually placed under a normal load but doesn't cope. So what we then do is change the stimulus, cause an adaptation to occur, and we will do that through things like stretching. It could potentially be stability work, it could be strength work, it could be range of motion, so a whole host of modalities that we'll work on to try and get you back to normal function. And
I've noticed different physios have different ways of treating. Some use special machines, some are really hands-on. Why is that?
Sometimes it depends on the era in which you were trained, and so therefore your age. Very much in the 80s we did a lot of electrophysical modalities, and a lot of that stuff was the interferential and the ultrasound and the things that we were placing on the body to try and work on. My training was slightly later than that, and consequently we came back to more hands-on stuff and far less machine work. And it means that what my focus is now is about education. Education and stability doesn't mean that it's either right or wrong, it's just a different focus.
So when I injure myself,
yes,
I've hurt my knee, which I have, and that's what you're doing today, you're having a look at it.
Yep.
So why should I go to a physio and not an osteo or the myotherapist? Is that right?
Yep.
Why should I not go to all those other...
Sometimes it's just preference.
Yep.
So sometimes it's just that that's what you've seen in the past and you know that works for you. All of the health professionals, osteopaths, chiropractors, physios, are all highly trained. We've all got science degrees of at least 3 or 4 years of training, and so consequently we could all treat a whole host of different things. Again, if you look at public perception, a lot of chiropractors and osteopaths are thought to treat spinal stuff and manipulate and look at adjustments in order to allow tissue to heal. Physios probably have a slightly broader public perception, and so consequently people are quite comfortable with physios. You can take a pick. It purely is just choice and selection and what you're comfortable with.
And what about my knee? Do you think I'm going to be able to walk again?
I think you'll be able to walk. I think it's intact. I think it's looking quite stable, structurally sound. I think you'll live to walk another day.
Yes, and what about my mind?
Not so sure about that, but we'll see. We're not working on that today, we're just working on the knee.
And what would you do if you had to work on my mind?
Oh, depends. So you might need to learn to breathe, calm down. You might need another week at the Golden Door.
Yes.
Bit of calm, quiet, peaceful meditation work. That might work for you a treat.
Yeah, and that might help my knee.
It might help your knee, absolutely. Slowing you down, definitely.
No need to worry.
No need to worry.
That's really bad, isn't it?
Yeah, terrible joke.
Okay, anyway.
Almost as good as the abs.